Are you suffering with an array of long COVID symptoms, especially those that are specific to cardiovascular abnormalities like a racing heart rate, elevations and changes in your blood pressure, fatigue, swelling of the lower extremities, and even just overall weakness? Today, I want to share with you possibly a condition that you might be experiencing that has been under-addressed and under-assessed for many long COVID patients, and it is called long COVID POTS. What we're seeing is that up to 50% of all long COVID patients are actually suffering with this post-viral disorder called POTS. And POTS is a syndrome. We call it Postural Orthostatic Tachycardia syndrome. If you think you might be suffering from POTS, you're not sure what it is, and you want to learn how to address it naturally, today I'm going to share with you some information that'll be impactful for you to arm you and equip you with also some resources to address the assorted symptoms of long COVID POTS. This is a very unique post-viral syndrome that is not like your typical POTS, but definitely is something that I am seeing in my own clinical practice with a lot of my COVID patients. So this video I know will greatly help you if you're suffering. Let's dig into it today. What we're seeing is long COVID POTS is a persistent increase in heart rate of at least 30 beats per minute within 10 minutes of standing. And the persistent symptoms include heart palpitation, racing heart, chest pain, even exercise fatigue, or overall malaise and cardiovascular angst. What is at root here and the ultimate cause of this long COVID POTS is the inflammatory response of your body from the COVID infection. When a patient has a COVID infection, regardless of if it's asymptomatic or severe and you might have been hospitalized and on event, what happens in the body is there's a triggering of something called the cytokine storm. We have cytokines that are inflammatory cells, and they are in overabundance, and the body is creating them in a massive form because of the viral invasion. This leads to neuron damage and a situation we call neurotropism, and ultimately what we see is neuronal dysregulation. Basically what that means in simple layman terms is the neurons in your brain and throughout your body, and particularly in your heart and cardiovascular system, they've been damaged through the inflammatory cytokine storm. They've been attacked, and we are noticing changes to your autonomic nervous system. This is really, really problematic because diagnosing this is really challenging for a lot of patients. 20 to 50% of long COVID patients complain of daily persistent heart palpitations and tachycardia. And the core issue here is a dysautonomia. That is a malfunction of the autonomic nervous system. So basically, your central nervous system has gone a little haywire, and the signaling to regulate your blood pressure, regulate your heart rate, and regulate your blood volume is out of whack. It's offline, and ultimately this ends up impacting your cardiac electrophysiology. And through that impact, we also see a decrease in the blood volume. And this is the presentation of long COVID POTS. There are three factors at play that are causing the symptoms you're experiencing. With the COVID infection, there's massive amounts of inflammation. We have inflammation of your vascular endothelial lining. So that's the soft muscle and this kind of single cell lining inside the heart tissue and inside your aorta, your arteries, veins, your whole entire vascular system. We also are seeing a condition called hypervasodilation. This simply means that your veins and your vascular valves, they're stuck in the open phase. They are in an intense state of vasodilation. And that vasodilation kind of flushes blood to certain areas and changes the blood volume flow. And this then leads to a condition called hypovolemia. And that is where your blood volume is imbalanced. So that trio of inflamed endothelial cells in the vascular channel state of being hyperdilated and a poor imbalanced blood volume creates this long COVID POTS. So the big question is, how do we treat this? And right now, there is not an established protocol that clinicians are using, but today I'm going to share with you some of the resources and tips I provide to my long COVID POTS patients. This is aimed at addressing that vascular inflammation. It's aimed at reducing and addressing the vasodilation, the overwhelmed and opened veins and vessels. And it also addresses that imbalance in the blood volume. So number one, the most important overall treatment for POTS, long COVID POTS, is to wear compression tights, compression stockings, compression socks. This supports the blood flow and the circulation, particularly in the lower extremities. This minimizes the burden of this vasodilation on your heart and can ease that fatigue, the rapid heart rate, the kind of overwhelm that your cardiovascular system is feeling. Now, the second resource is to enhance your electrolytes. One of the byproducts of an imbalanced blood volume is going to be an imbalance in your electrolytes. So enhancing your electrolytes via trace minerals, infusing every single bit of fluid that you're intaking with trace minerals, concentrating on potassium, magnesium, calcium, sodium, and chloride will greatly enhance that volume balance. I also recommend this particular protocol in the morning. As soon as you wake up, take a hit of sea salt. But there's one particular sea salt that I like the best. It's super clean and it has an amazing amount of electrolyte balance. And you can get the sea salt where it's kind of a larger grain, where you can place the sea salt, one little kind of thing of the sea salt, under your tongue and suck on that first thing in the morning. When you rebalance your sodium, that helps to minimize that volume deficiency. This sodium is very important for helping establish the right blood volume balance. Next, I want to talk about some herbals that are powerful for supporting vasoconstriction. With the long COVID POTS, your vessels are in this vasodilated state, and it's a hyper state. We don't always see them closing, so that constriction is not occurring, and that therein lies part of the problem. So we need to balance the vasodilation with vasoconstriction. And there are 4 herbs that are great for vasoconstriction: yarrow, hawthorn, rosemary, and ginkgo. They all work a little differently, but I'm going to share with you some ways to consume these. Ginkgo, I like to recommend a supplementation of ginkgo in the morning, lunch, dinner, and right before bed. So we kind of have this constant flow of vasoconstriction. I also like to recommend hawthorn as a liquid herbal or sometimes as a tea, and then brew up rosemary tea. You can grow rosemary in your garden, or you can grab it at your grocery store. You take off the little twigs of rosemary, you can chop it up and boil that in a tea. You can add in other teas for flavor, but rosemary is a powerful herbal for vasoconstriction. You can also add yarrow supplements to your routine. I will often recommend yarrow at night, an hour or 2 before you go to bed. It's not uncommon I have patients complaining about sleep imbalances. So if we vasoconstrict, that can help enhance your sleep and bring some balance to the dysautonomia. Now, the 4th tool that we need to deploy is we need to support your mitochondria. This is the deep cellular state of your cells and your cell health. And with the massive amount of inflammation and being in a POTS-like state, the mitochondria has taken a hit, and we need to restore your mitochondria so we start to change the state and functionality of your cells. Every single cell in your body, whether it's a muscle cell, a skin cell, an organ glandular cell, or a vascular cell, has a mitochondria or multiple mitochondria within. The mitochondria, after a COVID infection, we see them being very overwhelmed, damaged, and dysfunctional. I like to recommend MitoQ. It's a powerful mitochondria support. It's also a massive antioxidant, which cuts down the oxidative stress that we see from not only the long COVID state of POTS, but also from just the overwhelm of this inflammatory effect that the COVID infection has created in your body. Now, fifth, I want to talk to you most importantly about the herbals that are meant to address the blood volume issues, the hypovolemia. There are several herbals that can help enhance your fluid volume, blood fluid volume. My favorite specifically is targeting your liver, which plays a big role in the state of your blood health. Dandelion tea is a herbal that you can drink every day. You can drink it several times throughout the day. This is a great natural diuretic in that it helps to create a balance in your fluid levels. It's not a diuretic that is going to dehydrate you. And in many cases, depending on the type of dandelion you're drinking, it also is going to be dense in certain electrolytes. Now, the second herbal that I love for any cardiovascular imbalances is nettle. Nettle is also dense in potassium, and it also delivers some iron, which we see it not only hydrate your cells in your body, but also supports the red blood cells and overall blood volume. So I wanted to share with you these 5 resources for persistent and often debilitating post-COVID POTS. If you find that you are in this situation, in the description box, I will list all the different links and recommendations. Take a screenshot or screen grab of that. And if you want more information on how to overall address long COVID and to help your body recover fully from the viral effect of COVID, I'm going to invite you into my long COVID masterclass. This was built specifically with you in mind, and we address the multiple systems that COVID has impacted, and it's really aimed at helping enhance your body's turnover of any post-viral particulates and to help nourish your body and get you back to feeling like you did before the COVID infection. If you have any questions about long COVID or POTS, let me know in the description box below, and make sure you hit that subscribe and like button. I have a whole entire playlist dedicated to long COVID, and I'm going to be adding more and more videos throughout the next few months. I look forward to seeing you on our next video, and thanks for watching.